Tony Molchany. I'm the CEO of Mercer Bucks Orthopedics. So we are located in Pennsylvania and New Jersey. We have approximately 45 providers, which consists of physicians, extenders, and therapists. The benefits that we re-engineered with use of the HealthAsyst program, one is that obviously staffing is a critical part of your budget, and not necessarily looking to reduce staffing, but taking the opportunity to reallocate staff in a very positive manner, because the tools of HealthAsyst allowed the process to work faster, better, and more creative. Since the patient has preloaded much of that information and goes back to an exam room, clinical staff have actually spent less time having to go through and identify or review all of that patient information. So it's preloaded in the system versus the clinical staff having to sit there and type that in during a patient visit. As a result, you can calculate those in minutes of savings. And number two is that in the automation that allows us to do a much better job of focusing on the consumer's insurance, especially in this changing world of high deductibles. I believe consumers are more likely to pay a bill if they identify it, if they see it on the system at the time of check-in. Staff is less embarrassed to ask people about their outstanding bill. Three, I believe the collection process begins to take shape and unfold as a very positive. Certainly, collecting of smaller copays at the time that patient is checking in at the kiosk provides value, because at the back end, if you're not collecting that, you're generating a patient statement, you're mailing it, etc. People are more likely today to use credit cards because of the environment, high deductible environment. A lot of consumers have health savings accounts, flexible spending accounts, where they can automatically pay a copay versus the old-fashioned world of going to the desk and talking to somebody in person who may or may not ask the question. So that's a vital, important function that HealthAsyst provides because of the consistency of allowing somebody to pay at a kiosk station. An added value of HealthAsyst is that patients do not have to spend time in the waiting room filling out multiple pieces of information. It can be done private in their use of their home, uploaded to the system. That's really the key value. So they're spending less time completing paperwork in the actual office, and therefore, since it's complete, a patient can move through the system faster. In some cases, in our organization of orthopedics, patients that have surgery and come in for a post-op visit can quickly come through the system in an expedited fashion, because simply I'm checking in, I go to the kiosk, I check in, and within seconds can move through the system faster.